My name is Ellen Fengeri from Tony Waite Organization. I'm the Executive Director for Tony Waite. We have got programs that we are running at Tony Waite Organization. We are looking at health. In health, we are looking at women's health, newborn and child health. We are also looking at sexual reproductive health, rights for the youth. We've got hard to reach areas whereby we need to reach that cannot be reachable, and we've got in this provision of services for women's health, we work in partnership with Ministry of Health and Child Care. We also run livelihood projects for people living with life-threatening conditions or those who are vulnerable in the community. Along the livelihood, we are running community gardens. These gardens, we have people who are grouped up, and they have community gardens that they plow. For this season, we have seen them actually doing very well. They plow different sorts of vegetables, and they usually get surplus for sale. And when they get surplus, they can also use in whatever way they want to use their money due to identification of their own gaps. We are also running income generating projects, which are economic strengthening projects. These projects include chicken projects, piggery projects, goat projects, bakery bread making projects. We are also improving learning environments for schools. Here we are looking at construction of school blocks, whereby we have some schools with the buildings which are under standard. So we are improving environment. By improving environment, it's also a child right to learn under a standard structure. And also in these schools, we also put even teachers accommodation, so that the good teachers are also motivated to teach at such schools in rural areas. When we are looking at COVID-19, we also partnered with Ministry of Health in training church leaders, so that they also prevent infection within their congregations. And the training was also cascaded into the community, looking at community carers, different cadres who are working in the community, and in turn they are also cascading this information at grassroots level. Sexual reproductive health continues. We also have a project on reusable sanitary. We're looking at improving sexual reproductive health, where some are not able to buy disposable sanitary pads due to prices, and the reusable one will be actually good for them because they can use it now and again, just washing and drying it. We are also having a program in training on production of standard masks according to WHO guidelines. These masks, most we've identified that most people might walk around without, or there is just a single cloth that they are putting on. So we are training communities to make a reusable masks that they can wash and iron, and this will help actually if contribute to the prevention of infection of COVID-19. We also looking at anti-child marriages. We have noted also with concern that during this lockdown, more children will not be able to go back to school due to child marriages. We are looking at how best we can resolve the issue of anti-child marriages, and we are looking forward to sit down with the stakeholders and map a way forward to see how together we can prevent these child marriages during this time of lockdown. Though the early child marriages have been there, but they seem to be increasing due to the lockdown, because children, most of them are loitering around. They are not occupied. So with schools opening, we are looking forward to have children occupied so that they can have their time used. And we are also maybe running the youth clubs so that at least they have somewhere to get information on sexual reproductive health to prevent all sorts of diseases from attacking them.